As she said, I am Sadie. I am an American College of Sports Medicine clinical exercise physiologist who then became certified as a cancer exercise specialist, currently serving as a wellness coordinator in the Kansas City area at several Sarah Cannon cancer centers. And today I will be talking about nutrition and exercise for balanced health. And this is a topic really important to me because I feel like so many times when you're in healthcare, we're taking care of other people, but we don't always necessarily take the opportunity to take care of ourselves, and sometimes make it really hard on ourselves. But one thing that I've noticed and tried to in my own practice, think about if I don't take care of myself, how can I really fully take care of patients? And that they love when I can talk about personal experiences. And a lot of times we tell them to maybe, exercise, eat right. All the evidence is out there to know that that's going to help them in their own process through their journey with cancer. But how do we do that for ourselves? And then in some ways that helps us to better then connect with some patients. So I wanted to start out by just kind of saying, why do we need to have a balanced health? How does it help us as providers? How does it help us as people, just in our lives with family, friends? So I just did kind of a general search. What does balanced health mean and why is it beneficial for us? And these were kind of the top 5 things that came up across the board, no matter where I searched, that we really need to just have general health and well-being. It's just going to help our health. We're going to feel better. It's going to help our fitness, but it also improve our mood and our energy. And that's something that, we're stressed with our jobs. We're stressed with things outside our jobs. We work long weeks some weeks. So just being able to manage that mood and our energy levels. Less stress means more enjoyment. And sometimes it's hard to disconnect from the things that we're maybe doing in our jobs and the stress with our jobs or the stress at home. But maybe if you can enjoy, a nice meal, or you can go put some stress out of the way by going and exercising, we can decrease that stress a little bit. We're more efficient and productive. The more we can get up and move, the more we can fuel our body with good foods. It comes from that added energy and feeling a little bit better, but then we're going to be more productive. And then lastly, decrease burnout. This is in all aspects. We want to make sure that we're trained to do the things that we do, and we're trained to help people so that we can do that for as long in our lives as we are able to. So I want to kind of, as I go through this, you'll kind of see I'm going to talk about the guidelines. In exercise, we'll start out, and then we'll kind of move into nutrition, and then talk about how do we practically apply that knowledge to our own lives in a way that maybe makes it a little bit easier. So the American College of Sports Medicine and the CDC made a recommendation. This newly came out in 2018, and even since then, they've said that these recommendations even apply to a lot of our chronic disease populations. So they talk about 150 minutes of moderate intensity activity, as well as at least 2 times per week of strength training. And so what does that look like? 150 minutes of aerobic exercise. What does that mean? What does strength training mean to us to get those 2 days? And so I wanted to bring our attention to this picture. This might be what sometimes we think aerobic exercise has to be. Who can jump the highest, run the fastest, run the furthest? Maybe you're on a bike or an elliptical and you have to go as hard as possible. And sometimes that's the last thing that we want to do at the end of the day or the beginning of the day if that's when we're able to exercise. And so what if I told you this is maybe all you had to do? Can you find a colleague, a friend, a family member? Can we walk? Realistically, moderate intensity is getting the heart rate up, increasing our respirations, so that maybe if we tried to have a conversation, we'd get a little bit breathless, but you could still hold a conversation. It doesn't have to be, it feels like your heart's going out of your chest and, you're just like profusely sweating and it's maybe not as enjoyable, but can we just get up and move? Or in COVID, a lot of virtual options came out. So maybe you can't go to the gym, or maybe it's the winter and you can't go outside, or it's too hot outside. Can you pull up a dance video? Can you pull up an aerobic video at home to do some aerobic exercise? And then for strength training, men, women, a lot of times we think like we have to lift heavy, we're going to get bulky. That's not what I want. We have to think we have to go to the gym, but maybe the gym is, a little intimidating. Maybe if you haven't strength trained before, it's just a bunch of, bigger dudes, and maybe that's not where we want to be. And if it is, that we shouldn't be afraid to be in those spaces. But what if we can have it look like this? Again, it doesn't have to be weights. It could be body weight. It could be resistance bands. In the bottom, you see a woman doing like a yoga or a Pilates. Realistically, strength training is activating the muscles. And we can activate our muscles in a lot of different ways. It's not just weights. It can be weights. And honestly, in the top right there, you see a bunch of women doing a group exercise class with some, plates. They probably have dumbbells, barbells potentially. In my time of going to group exercise class, more than 50% of the people in most of those classes are women. And so not being afraid to, try an exercise class, because a lot of times you'll learn form. It's a fun place. Once you get in that community of that class, you're going to have people ask, like, are you going to come back? We haven't seen you in a while. And the same type of thing goes for at home. With minimal equipment, you can do a lot of different options at home. And so for today, before we get into nutrition, I thought that we should exercise a little bit to get ourselves moving. It's the first session of the day. And I think that sometimes we think, I'm going to look really weird sitting at my desk doing exercise, or it's going to have to be these big movements, and I'm going to look kind of weird. But I'm going to ask everyone to stand up, and we're going to do some marching in place. I'm only going to make us do about 10 seconds of each because I want to get into some more of the nutrition and the prep. But marching in place, great exercise. You're talking on the phone. You're at your desk and you're just like, you've been sitting for a while, maybe your low back is hurting a little bit, march in place. I'm gonna have a sit back down because we're gonna use our chair in the third exercise. We're gonna do some seated shoulder blade squeezes. So bringing those shoulders back and down, kind of like you're pinching a pencil in between your shoulder blades. We sit at our desks. We round our shoulders forward. This is a great way to release the chest, open up those shoulders and work those upper postural muscles by squeezing those shoulder blades back and down. This is a great one even for patients. They're sitting in an infusion chair maybe, or they're waiting. Can we just ask them to squeeze their shoulders, work those postural muscles? And then next we're going to sit to stand. So just up and back down. Doing 10 of these in the middle of your day when you're feeling that afternoon lull, and we just want to get up and start moving a little bit. So sit to stands, great functional exercise. Even asking your patients, can you get out of a chair without using your hands? Not everyone can, so really good exercise to work on. And then we're gonna finish up, and the last one I have is high-low punches. So you punch high and low. And this may seem kind of crazy or weird, but maybe it's a stressful day, and you just need to use your core and punch it out a little bit. And it might seem silly, but we get our bodies moving. And last couple, and rest. You can sit back down. But we can feel in that short, 40 seconds to a minute, our heart rates got up a little bit. We got to giggle a little bit about punching at the end. We got up and out of our chairs. We march in place. Something so simple, but effective, just to move the body. And so my last slide, in terms of exercise specific, is kind of the guidance of exercise. And this pyramid is a very simple thing, but it's not always easy to do. But at this base level, we know just by increasing our daily movement, we can really feel a lot better. Our jobs have become sedentary. Our transportation is a lot of times sedentary. We're not, moving around, but, even just being up and having a meal, going and getting our groceries, playing with kids or family or friends, going for that walk, and then we're able to get that regular aerobic and strength activity. Let's get that heart rate up, like it says on there. Moderate aerobic exercise is an increase in heart rate, an increase in respirational rate, but it's still conversational. You don't have to do anything crazy. And then that strength, let's just use our muscles. So getting that kind of in that middle. And then the top is really decreasing our sedentary time. So when I think about practical application of these guidelines, it is this pyramid. Increase our daily activity, get some of that muscle activating and that heart rate increasing exercise, and at the top, when can we reduce our downtime or our sedentary time? And then I want to get into nutrition. So I kind of went out and looked, what are the agricultural guidelines in the US? What are our dietary guidelines for Americans? And I think we can all maybe say, like, we remember the food pyramid. So similar to our exercise pyramid, we had the food pyramid, and then that switched to something more like My Plate, because then it was visual. Maybe the pyramid didn't make sense. You couldn't picture it when you had a meal. But even when I think about some of our dietary guidelines, we have, okay, you need, 5 to 6 cups, servings-ish, whatever a serving is. Sometimes we don't know with some of these things of those fruits and vegetables. And, a serving of meat is what, the size of your palm or a fist, or that's how much protein you should have. And we try and make these things practical, but we kind of have this, okay, look on the left, we need 64 ounces of water, half your plate should be veggies, the other half, you cut it in half and you have your proteins and your grains. Again, that dairy kind of goes into the protein, but it's kind of a little bit separate too. And then most of our things don't even talk about the things on the right of the screen there. Things that we enjoy, things that, we have, and they just say, eat in moderation. Well, what does that mean, and what does that look like, and how do we think about some of those things, and how can we get away from trying to say absolutely not, because that doesn't always work. We can't, cutting out something of our diet maybe isn't always healthy. And so I really liked then thinking about this picture. Again, on the left side, we've got our Starbucks, or we've got our, different places to go and eat out. And when you look at that food, you see a very small portion. And I'm not even saying that that's bad, but just acknowledging that that is how much, is approximately 1,500 calories. Versus looking at the other side, we've got a mixture of fruits. We've got, some soup that probably has some fresh, fresher chicken and some veggies in there, the broth. But it still has chocolate on the other side, and we've got a salad in a jar, and that could be a whole day of a meal, kind of looks like that on the right, and just acknowledging that. So the couple things I wanted to think about that are maybe a little more practical in terms of nutrition, maybe not demonizing specific things, but how do we think about caloric density? Things that are higher in calories, but maybe not so much in nutrients. They usually have a little bit more sugar, fat, things like that, versus nutrient density. Thinking our fruits, our vegetables, grains, fiber, everything, and then getting into, technically there are foods in both categories. We think about avocados, great, but also higher in fat. We think about, even nuts, seeds, nut butters, they probably go into that category. So then, can we look at portion and frequency? Not saying no to anything, but how much of it do we eat and how often do we eat of it can maybe help you decide on that balanced diet. Because we know sometimes when we restrict things, then that's all you want. And then that portion size gets a little bit bigger, or you eat it a little more frequently, and then you totally cut it out for a long time, so you eat it more frequently again. So I think when we think about balanced diet, can we kind of think about those 4 things? Which category does this food go into? How much am I eating of it? But if you enjoy chocolate or you enjoy ice cream, I'll admit that those are things you enjoy. If you want to treat yourself and go get, a more sugary or higher calorie coffee, then that's okay. But how can we have that balance so that we feel that we have been doing a good job and that we have nourished ourselves both healthfully, but also things that we enjoy? And so I want to kind of, in terms of bringing this all back together, how do we implement these guidelines? How do we take the guidelines and the guidance and then put it into practice? So the steps that I kind of think about, assess your priorities. Where is exercise important to me? What type of exercise is important to me to try and reach those guidelines, but increase my daily movement? What are my priorities with food? Do I want to be able to, cook at home? Do I want to be able to have meal prep? Do I want to be able to go out to eat? What does that look like? And then set some goals. How many days a week do you think you can exercise? How many meals do you want to make at home? Maybe you want to have a salad every day for good fiber, and then that, is a nutrient-dense thing to be able to have maybe a more calorically dense thing other times, or how do you mix that together? So what are our goals? Make time. What do we need to add or remove? So it takes time to prep food, or to maybe go out if we're going to eat food that's maybe not fast, but maybe a little more nutritious because we sit down. Or for exercise, is it the morning? Is it the evening? What do we need to add to our schedule? Or is there something that's taking up time that maybe we don't really need to be there? So how do we kind of look at that? Starting with our strengths. If you eventually want to take maybe a higher intensity exercise class, but starting there maybe isn't where you want to start. How do we start with our strengths? Is it easy to just start with a walk? Maybe that's something you've done before, or that if you go to an exercise class, that's going to hold you accountable because you put it in your calendar. So where do we start with our strengths? What am I good at when it comes to food? Do I need to prep it? Do I need to grocery shop at a certain time? Do I need to make a list of the things that I need? And then small, frequent steps. We don't have to go all the way from here to where we want to be. But what are those, I like to call them process goals, because we talk about SMART goals, making them specific. And it's okay to have a long-term goal, but how do we get there? Kind of what does that journey look like? And then celebrating accomplishments. Adding that exercise into your routine and then thinking, okay, I'm going to, exercise 20 days out of the 30 days of this month and have a calendar. And at the end of the month, how do we celebrate that accomplishment? And I like to think about from a balance perspective. We, as a society, a lot of times think celebration has to be food. We celebrate birthdays with cake. We, celebrate something, maybe you have a glass of wine. Like, that is fine. But also, what are other ways to celebrate? I love telling patients, do you need a new pair of tennis shoes? Do you want like a new workout outfit? Do you maybe want to try a class where maybe you have to pay a little bit or do something? Do you want a new piece of exercise equipment for at home so that you can make it more accessible? So celebrating accomplishments differently. And so what does that look like and how do we do that? And so I want to think about kind of my left three are things to decide when you're setting these goals of each of them. What is our enjoyment? What do we enjoy for exercise? What do we enjoy for food? I have tons of people who are like, in terms of food, I hate vegetables. And we know that they need to eat vegetables, the nutrients, the fiber that's in there, but they hate vegetables. So I say, okay, can we hide them in something? Can we make a soup? Can we make a smoothie? But how can we get your vegetables? Do you prefer them cooked? Do you prefer them raw? How do we put that in there? Because we still need them. Maybe, when you think about cost even for vegetables, maybe they can't afford fresh vegetables, so we, try frozen vegetables. And what does that look like? How can we enjoy it? Same with exercise. It doesn't have to be the heavy weights, but maybe that's what you enjoy. Or maybe you do an exercise class that gives you a little bit of both. Time. How much time do you have to do these things? You don't have to exercise for an hour. If you break down those guidelines, it comes out to 20 to 30 minutes, 5 to 7 days a week. So what does that look like? It doesn't have to be all the way one way, just working at it a little bit at a time. Maybe the 150 is the goal, but maybe starting at 60 minutes a week is what we have to offer right now, and that's okay. Same for food. Maybe you only can make and commit time to make one big meal a week. Well, can that dinner be your lunches the rest of the week? And then you've spent the same amount of time, instead of feeding one time, we've prepped then for the week. So what does our time look like? And what's our environment? How do we exercise at home? Do we need a gym? A lot of people tell me, I can't be in the mode to work out at home. So how do we take it outside the home? What does that look like? For food, do we want options at home? Do we want options at a friend's house? Do we want options at a restaurant? Kind of preparing, where am I at to have this balance, and what does that look like? And so then ways to implement these things. Creativity. The internet is a beautiful thing. Friends are a beautiful thing. Can you, find a cool cookbook? I have really enjoyed getting into Mediterranean cooking. We know that a lot of what that diet is focused on is very balanced, very healthy. They still have sweets and other things in there too, but maybe like buying the Mediterranean cookbook and deciding, okay, this week I want to cook, a soup, and the next week I'm going to cook an entree, and how do you work your way through that? So getting creative with that. Getting creative with your exercise. Can you get something at home where it gives you lots of different options? Can you walk? Can you dance? Can you do Pilates? Can you do yoga? Let's mix it up and be creative, because sometimes doing the same thing gets boring. So how do we make it not boring so we want to keep enjoying it? Professional help. Do we need a dietitian? Would a dietitian help us? Would they help us, meet our goals? Do you want, a personal trainer, exercise physiologist, clinical exercise physiologist, someone even to just help you plan? Or, there's tons of people at gyms. Can you go and get a tour of the gym and figure out what group exercise classes that they have to offer? So what does that look like? And then lastly, technology. So we have our phones, we have everything. There's trackers, there's apps. If your phone's in your pocket all day, can you have a steps app? Just to know, okay, today I have only taken 2,000 steps, so I'm going to do walking as my exercise tonight. Or from a nutrition standpoint, where do I want to be? What are my goals? But there's so many different pieces of technology out there that can help us reach, our goals in terms of having that balance of health in nutrition as well as exercise. That, I believe, is my last slide. I have some resources where I went and searched some things out. But questions?
Do we have any questions?
Yeah.
How do I get my family to buy into participating with me
Yeah.
and, do this for mom?
Oh, yeah.
So that mom will do it?
Mm-hmm. I think that's
got
great.
an idea on how do I get them? I have a 19-year-old and a 21-year-old who live at home with me while they're going to college.
Yeah.
And, I don't want them to end up like me.
That
So I
you
want
want
them-
to instill
I want
those
them
thoughts.
I want them to start doing that and then take me along with it
Right.
so that I can spend time with them that we're not eating
Right.
or watching a movie.
Right.
I
I think,
what's a tip to bring them in for that?
yes, a couple different things. So from a cooking standpoint, can you make it a team thing? And then you get that cookbook, you get that recipe, and then you say, you're going to prep this, you're going to prep this. These are our jobs. So kind of doing that. In terms of the exercise, I think scheduling is a great way to do it, and knowing, what does that look like? Can you say, today we're going to go on a walk. It's nice out. It's this time. This is our exercise time. And we're going to do it together because this is important to me. And sometimes that's the hardest piece, is having that conversation. When COVID happened and I was away from most of my family at the time, I said, I'm going to get on Zoom at this time, and I'm going to pull up an exercise video, and whoever shows up, you're going to do it with me. And we're going to make this a fun family opportunity. And my dad had just gotten pre-diabetes, and now he doesn't have it anymore because I was like, I don't care, we're going to exercise together. And I put it on the schedule. So I think this is something very close to my heart, as you can notice, but having that set time, this is something that's important to me. Let's have this conversation. I want to do this thing for food. I want to do this thing for exercise. Let's make a time. Let's talk about what are some of the different things that we want to do. Maybe have a little brainstorming session as part of that. Do you like to walk? Do you like to dance? What things can you do at home? Again, you could pull up a video. There's tons of walk exercise things where they bring in squats, and then you do side steps, and then you do up, up, down, down. So many different ways to do that. But having the conversation, I think, is the first step, and then putting it on the calendar with that brainstorming session so that it happens, and having that accountability to each other that it happens. Yeah.
Yes, ma'am, very nice talk.
Thank you.
But I want to ask you that exercise of moderate degree
Yes.
should help for pre-diabetic, diabetic, cancer patients, hypertension, and so on.
Yes.
But doing little exercise, what you told here, will it help in these things? One. Two, moderate exercise, meaning that at least your heart rate should increase and you should become little tachypneic.
Yeah.
And there should be mild sweating. If that is there, that means you are doing a moderate exercise.
Yes.
But if there is no sweating, no increase in heart rate, no increase in respiratory rate, those exercises may not help for pre-diabetic, diabetic, hypertensive, degenerative diseases, and cancer and all. So one is
Yes.
this to clarify from you.
Yeah.
And second, okay, I'll ask you the second question
Yep.
also after finishing this.
Okay,
Thank
so the first question kind of intensity based. You know, what is the right intensity? So in terms of strength training, activating the muscles, I tell people sometimes, like, your heart rate might not increase that much when you're doing strength. If you're, you know, I have tons of patients that maybe they're not ambulatory to get out of a chair, or maybe I don't feel even safe for them to do standing exercises, so they exercise in the chair, and doing that is increasing their movement though. So even though it might not have as much benefit as the moderate intensity, it is something, because we know that just laying around, we're gonna lose all that muscle, and we're gonna have comorbidity upon comorbidity, and it's just gonna get out of control, and side effects get out of control when it comes to cancer treatments, medications even. So moderate intensity would be ideal. When I think even about the 150 minute, that's the minimum amount. Like, we see benefits at 150 in those 2 days. Realistically, I would love for people to build up closer to 300, but we also need to, with that balance, know that maybe that's not where we get, but can we get people to the 150? But it's still increasing their daily movement. So I'm not saying it's maybe not as high of a benefit as that 150 or that heart rate up. But also, if someone is less fit, less movement gets their heart rate up more. And so that depends on the fitness of individuals. And that's why, you know, long term, I would love that, you know, we have clinical exercise physiologists, or we have exercise professionals in more hospitals, because I can assess someone and know this is your resting heart rate, this is your estimated heart rate max, and this is where I want your heart rate to be. And everyone gets a heart rate monitor. And while you're sitting there marching in place, I ideally want you in this range. And I think we could get people there to have the best benefit. But if I can get someone to do something instead of nothing, there's still a benefit.
And the second question is about eating. Suppose you recommended fruits very highly, but if we take high fruits, then it is bad for fatty liver. So can you recommend how much fruits one should take daily? Thank you.
So in terms of fruit, I would then look kind of like at going a little deeper into it, glycemic index. So there are fruits that are higher in fiber, lower in sugar. So what does that look like? I mean, fruit is great. It's got great nutrients, so where can we get that? I mean, if someone gets 2 servings a day, I still think they should have some fruit, or we need some fruit at least every other day. It needs to be incorporated in the diet, and then really trying to emphasize different vegetables and supplementing that, because it still is fiber that if they're not getting the fiber from the fruit, we still need fiber for digestion and health and things like that. Secondly, in terms of when we have fruit that's higher fiber, it has that lower glycemic index because the fiber helps and slows that digestion. So that would be kind of trying to go for more of those types of fruits, and then still knowing, like, okay, we can't eat 5 of fruit and 1 of vegetable. Like, the emphasis needs to be vegetables for nutrition and those nutrients, and then just decreasing that fruit level, especially if that's a predisposition for that person.
So thank you. I think what you're doing is really important, and it was a great talk. I do want to mention that I found myself unlearning a lot of the cultural associations with food. You know, cupcakes is a treat. Everything that's really bad for you has always been associated as a positive award of some kind.
Right.
And I think unlearning that and making good food the award is difficult. And a lot of our social interactions are surround food and dinners out and parties and cakes and things like that. And what I've done differently with COVID is, you know, if our friends and I want to get together, maybe we'll get a cup of coffee and do a walk. We'll do a 5-mile walk or just talk. We get the same amount of catching up, but we're doing something physical. We'll take a bike ride. And I think that has changed. And the Peloton world has exploded. But there's a lot of ways to do that. But I think unlearning, especially with my children, what is really not a treat and it really isn't good for them has been difficult. And as far as fruits and vegetables, I struggle. Those are hard to snack on. They don't come in a bag. They don't sit in your pantry. They can't be quickly grabbed. So I think the more prep, as you said, you do, if they're cut up and they're ready to go and the fruit is in front of you and someone is giving it to you, it's a lot easier. But thank you so much.
Yeah, no, those are great points. In terms of sweets, when we want to be careful, there is so much out there about how to change things up. A black bean brownie where you can't even taste the black bean, or pumpkin brownie, because the cocoa powder actually kind of overtakes some of that pumpkin-y or vegetable-y taste. So how can we put fruits, vegetables, healthy alternatives into some of those foods that we grew up learning that's a specialty food and it's one that you should stay away from? And we restricted so heavily, and that's not healthy for mental health. And then, switching some of those things up, buying, cut up carrots already, if that helps.
Good morning. Great talk and very motivating. Can you tell me the difference between soluble and insoluble fiber?
Yes. Nutrition's not my focused area, but in terms of how we digest it, so from what I can kind of remember in the little nutrition I had, is one digests more in terms of, turning into bowel changing, versus insoluble fiber. It's harder for us to digest and it more moves with it. So that's more like bulk versus breakdown.
One other question, and thank you again. It was great talk. Can you comment on sleep and how much we should be telling our patients? And we know we don't get very much, so that's we can't follow our own advice. But could you make a couple of comments on that and what's needed?
So when we think about sleep, part of that is related to recovery. And so when we are sleeping, there are a lot of processes that are happening inside the body to repair. And so we think about, chemo breaks things down. The body is breaking down from radiation. So I definitely think increased levels in terms of total time, they probably would need. We even think about kids as they develop. They need more sleep because they're developing. I think we kind of need to think about that in the same way. I like to tell patients, if we can get as much of it at night, awesome. But if we need to supplement that with naps, then in between your naps has to be something where you move, because otherwise we're just laying down. So can we activate those muscles? Can we, if it's a really bad day after treatment, we get up after we nap, we have to walk, we have to go get something healthy to eat, we have to, walk a couple circles around before we sit back down again. So it's when we sleep during the day, how do we move when we're not resting? What things can we do around the house to get some things done? I think in the evening, even I have a lot of patients where when I say the 7 to 9 hours, they're like, but I can't sleep because I'm on a steroid, or something is part of my treatment is making it so I can't sleep, or it's the night before and they have such anxiety about going in the next day, they're not sleeping, and then they sleep through treatment. So I think having the general idea of we'd love for it to be that 7 to 9, even 10 hours, but that doesn't always happen. So how do we sleep to recover, but then move and do other things to take care of our body instead of just staying sedentary?
Thank you so much.
Yeah.